Hi everyone, my name is Rita. My presentation today is on human immunity. Why immunity? Humans require immunity to counter against infections. By infection, we mean an invasion of the body by microorganisms resulting into harm to the body. Infections can be from bacteria, viruses, fungi, parasites, all of which are referred to as pathogens. Infection transmission can be direct or indirect. When it comes to the defense humans have, we have three major lines of defense. First line of defense, second line of defense, third line of defense. Both first and second line of defense are called non-specific defenses, while third line of defense is called specific defenses. The first line of defense represents the first human defense against infectious attack, and it consists of physical, mechanical, and chemical barriers, which helps to prevent entry of pathogens. For example, the skin is a critical physical barrier that creates an external boundary to the outside world. From the diagram, you will see that it comprises three major layers: the epidermis, which is the outermost layer, the dermis that lays underneath the epidermis, and the subcutaneous layer, which forms the deepest section. In terms of being a barrier, the epidermis prevents or at least hinder penetration of microbial organisms, chemical irritants, and toxins. It also absorbs and blocks solar and ionized radiation and inhibits water loss. Medical defenses include the shedding of skin cells, exposure of mucus, excretion of feces, and the flushing of action of urine and tears, which both serve to carry microbes away from the body. The mucous membrane is the moist inner lining of some organs and body cavities, like the nose, mouth, lungs, and stomach. Because they are rich with mucous glands, it helps to lubricate and protect these organs and cavities from abrasive particles and bodily fluids, as well as an invasion and invasive pathogens. When the first line of defense is breached, the second line of defense kicks in. They are also a form of non-specific defenses, which can be provided by special cells like phagocytes, macrophages, and neutrophils. Proteins like complement proteins, interferon, and cytokines. Other responses include inflammation and fever. One of the specialized cells for the second line of defense is phagocytes. These are large white blood cells that engulf foreign material through the process of phagocytosis. By phagocytosis, we mean the engulfing and destroying of damaged, defective, or invasive cells. Phagocyte includes macrophages and neutrophils and dendritical cells. One of the proteins for the second line of defense are complement proteins. They are a range of blood cells. They are a range of blood proteins which contribute to the breakdown and ultimate removal of pathogens from the body. The presence of pathogens can activate them, and once activated, they interact with one another to form a cascade of reactions which attract phagocytes to remove foreign particles, initiate inflammation to attract further phagocytes to the site, and produce proteins that can attack the cell membrane of the invading organisms, causing them to rupture. Cytokines are interleukin, which target white blood cells, menokines produced by monocytes, leuphokines produced by lymphocytes, and interferons produced in response to the presence of viruses. Other second line of defense includes inflammation, which is a physiological response to increase the white blood cell count at the site of infection. The key signs of inflammation are redness, swelling, heat, pain, and altered function. Fever is a system-wide sign inflammation that raises the body temperature and stimulates the immune response by stimulating leukocytes to kill pathogens, inhibit the growth of many pathogens by the rise in body temperature. Before we continue with the third line of defense, let's define a few key concepts. The first is antigens. They are proteins that are found on the surface of the pathogens. Antigens are unique to that pathogen. For example, the whooping cough bacterium will have different antigens on its surface from the TB bacterium. Antigens can be any type of molecule like protein, carbohydrate, and fat. Antibodies are proteins produced by the immune system that protect you when antigens enters your body. Antibodies are always Y-shaped and have a unique binding site shape which locks onto the specific shape of the antigens. When an alien substance enters the body, a type of white blood cell called lymphocyte recognizes the antigen as being a foreign and produces antibodies that are specific to that antigen. Antibodies' role within the body includes targeting an infection, recruitment of immune cells, neutralization of toxins, complement activation, stimulation of cells that can eat foreign substances, and the activation of mast cells. Different types include IgA, which plays a role in localized defense mechanism in external secretion like tears. IgD, which is involved in recognition of the antigen by B lymphocytes. IgE, which is involved in an allergic reactions. IgG, which is responsible for complement visation. IgM, which is also responsible for complement visation. The third and final line of defense is the immune response, which is also known as adaptive or acquired immunity. This response is not restricted to the only site of infection but occurs throughout the body. Acquired immunity is not present at birth but essentially a learned response from the body's immune system. The hallmark of acquired immunity is ability to learn, adapt, and remember. It plays two main roles, which are to identify and destroy specific pathogens and to build long-lasting immunity against the pathogens in case they infect the body again. Acquired or adaptive immunity has two major lines types: naturally acquired immunity and artificially acquired immunity. Naturally acquired immunity, this occurs via contact with a pathogen. When the immune system detects a foreign antigen, it stimulates the body to produce antibodies that remain in the body and attack and destroy the specific antigen when it invades the body, thus acquiring an immunity to a future attack. Naturally acquired immunity can be conferred either passively or actively. The second line of acquired immunity is the artificially acquired immunity. Artificially acquired immunity develops only via deliberate actions like vaccination. This is more proactive as it can help fight off infectious agents even before symptoms can manifest. Artificially acquired immunity can be conferred by either passively or actively. Artificially acquired immunity differs from naturally acquired immunity in that artificial immunity involves some form of human intervention, whereas natural immunity entails exposure of the body to a pathogen without any human intervention. The immune response is made up of specialized white blood cells or leukocytes. Leukocyte cells involved in defending the body against infections and foreign bodies. White blood cells are five different types of different type, which are neutrophils, lymphocytes, monocytes, eosinophils, basophils. All are produced in the bone marrow. The acquired immune system mainly involves two types of white blood cells: the B lymphocyte B cell, which accounts for 10 to 50% of all lymphocytes, and activated when they encounter a known antigen. When activated, B cell release huge number of antibodies which then engulf and digest the antigen. B cell play two major roles in terms of immune response: antibody production and presenting antigens to T cells and providing signals for T cells activation. Two types exist, which are plasma cells and memory B cells. The other white blood cell is the T lymphocytes, which are relatively common and account for about 80% of all lymphocytes. They play a vital role in the destruction of problem cells in the body. Also, cells infected with a virus and cells with DNA damage. Three types exist, which are cytocytic, suppressor cells, and helper T cells. Self-tolerance is the ability of immune system to recognize self-produced antigens as a known threat while appropriately mounting a response to foreign substances. This balance of immunological defense and self-tolerance is critical to normal physiological function and overall health. The unique nature of antigens allows the human system to distinguish between self and non-self, therefore enabling only the non-self to be attacked. Two of the most important factors in allowing the immune system to distinguish between self and non-self are the major histocompatibility complex and the human leukocyte antigen gene complex. The ability to discriminate between self and non-self antigens is vital to the functioning of the human system as a specific defense against invading microorganisms. This basis for self-tolerance failure is not clear, but a few hypotheses suggest a combination of substitute genes, tissue damage, and environmental factors. Failure of the immune system to tolerate self tissues can result in pathological autoimmune state, leading to deliberate, debilitating illness and sometimes death. One of such is autoimmune disease. Autoimmune disease happens when the body's natural defense system can't tell the difference between your own cells and foreign cells, causing the body to mistakenly attack normal cells. Common symptoms of autoimmune diseases include fatigue, joint pain, swelling, flare-ups, which can occur especially when symptoms worsen, and remission, which occur when symptoms elevate or disappear. Autoimmune diagnosis can be difficult. There is usually no single test to diagnose autoimmune disease. This is largely due to the huge number of the different types of autoimmune diseases and the similar symptoms they present. Diagnosis can involve identifying the antibodies their bodies is producing and from these determine which of the many types of autoimmune disease they have. It can also involve several potential tests like antinuclear antibody test and complete body count. Autoimmune diseases have no cure yet, hence, treatment generally revolves around managing the progress of the disease and to decrease the severity of symptoms. Likely treatment options include eating a balanced and healthy diet, exercise regularly, anti-inflammation medication if joints are affected. There are more than 80 types of autoimmune diseases that affect a wide range of body parts. For example, type 1 diabetes. Your antibodies attack and destroy insulin producing cells in your pancreas. An infection or another trigger causes the body to mistakenly attack the beta cells in the pancreas that make insulin. Symptoms include feeling hungry and thirsty, feeling numbness or tingling in your feet, vomiting, deep and rapid breathing, stomach pain. Another example is rheumatoid arthritis. With rheumatoid arthritis, your immune system produces antibodies that attach to the linings of your joints. Your immune system's cell then attack the joints, causing inflammation, swelling, and pain. Symptoms include swelling, warmth, stiffness, fatigue, and weakness. Treatment include various medications that reduce immune system overactivity. What is transplantation? Transplantation is the art of transferring cells, tissues, or organs from one site to another, in most cases from one person to another. This process helps to correct the malfunctioning of an organ system like kidney, liver, heart, lungs by replacing the damaged organ with a healthy organ from a donor. The immune system presents a formidable barrier to the transplantation process as it is recognized as foreign by the recipient immune system. There are three types of rejection, which are apyacute rejection, acute rejection, and chronic rejection. Chronic rejection, which can take place over many years. Transplant rejection can be overcome by tissue typing, which ensures that the organ or tissue of the donor is as similar as possible to the tissues of the recipient. Another way is monoclonal antibodies, which can be used during and after surgery to knock out the specific T cells which cause the rejection of the organ. What is an allergy? An allergy reaction is the response of the body's immune system to what is typically a harmless substance or substances. This can include pollen, certain foods such as nuts, dairy, or gluten. Two types exist: IgE mediated and non-IgE mediated allergies. Treatment and management of allergies involve avoiding the allergies, immunotherapy, and medications like medicated eye drops. Vaccination is the art of introducing a vaccine to the body to produce protection from a specific diseases. By vaccine, we mean a preparation that is used to stimulate the body's immune response against diseases. Vaccines contain killed, weakened, or synthetically manufactured versions of the disease, causing germ or parts of the germ called antigens. Some newer vaccines like the COVID-19 mRNA vaccine contain instructions for producing antigens rather than the antigen itself. Other components includes stabilizers, preservative, adjuvants. How vaccines work. When a person gets a vaccine, the immune system responds to the antigen as it were exposed to the actual germ. It then makes antibodies and remembers how to defeat it. When the body gets exposed to the actual germ, the immune system can recognize it right away and quickly fight it off to prevent disease. The benefits of vaccination are many and include protection against serious illnesses, diseases. Also, it is a cost-effective public health intervention. It has resulted extendedly life competency, also economic growth, as poor health can limit economic growth, especially in developing countries. Several factors have affect vaccine uptake, but a key factor is vaccine safety. Parents look at the safety of a vaccine before allowing their children to be vaccinated. Other factors include seasonality of certain infection diseases, issues of side effects, poor planning and logistics for delivering effective vaccination program. What is herd immunity? Herd immunity is an indirect protection from a contagious infection disease that happens when a population is immune, either through vaccination or immunity developed through previous infection. This provides an important way of gaining protection from contagious diseases such as smallpox, measles, polio, and COVID-19. To develop herd immunity against a highly contagious diseases, about 70% to 90% of the population needs to be immune. Herd immunity can be developed through vaccination and through previous infections. Unlike vaccination, herd immunity does not give a high level of individual protection, and so it's not a good alternative to getting vaccinated. Thank you for listening.